So, hello, I'm David Luongo, and today I have the pleasure of speaking with Dr. Keith Yeates, a board-certified clinical neuropsychologist. He is a professor of psychology and adjunct professor of pediatrics and clinical neurosciences at the University of Calgary, where he also leads the Integrated Concussion Research Program. In addition, he serves as a chair of the Canadian Concussion Network and has over 35 years of funded research experience in pediatric traumatic brain injury. Dr. Yeates will be speaking at the upcoming SNS Symposium in Cleveland this May, where he will present a talk titled Biopsychosocial Considerations in Pediatric Sport-Related Concussion. Dr. Yeates, thank you so much for being willing to speak with me today.
Thanks for the invitation.
So to get us started, could you briefly explain what a biopsychosocial approach to pediatric sport-related concussion means and what it may add beyond a more traditional injury-focused model?
Sure, it's a lot to try to pack in 50 words or less, but back in the late 1970s, there was a recognition in the field of medicine of the need for a broader perspective, moving away from a strictly biomedical model. Really seminal article by Engel in 77, in particular in the journal Science, uh, uh, advocated for a biopsychosocial perspective. And while over the years there's been certainly recognition of the importance of particularly the psychosocial side of concussion and traumatic brain injury in kids, at times we tend to slip back into a focus on the injury itself, rather than the brain that comes to be injured and the circumstances in which that brain finds itself. And I've been an advocate for many years of trying to understand concussion or traumatic brain injury in kids from a multi-level perspective, appreciating the nature of the injury, but also the psychological overlay, and then the broader family and community and school environment that kids have to function in. So in sport-related concussion, the same applies. There's nothing distinctly different about sport other than, again, you have to take context into effect. So we actually have some evidence that kids and adolescents recover a bit more quickly from sport-related concussion than they do from concussion arising from other causes, for example. So it's really a cautionary tale at one level of let's not get so seduced by MRIs and by blood biomarkers and by other biologically oriented ways of understanding the injury, but understand the injury in a broader context. And actually, it's a more hopeful message because it suggests that we can intervene at multiple levels. We can intervene at a medical level potentially, although most clinical trials at that level have failed miserably. But now we're looking at things like neuromodulation and other really exciting sorts of advances that are more biologically. But we're also increasingly recognizing the importance of the psychological status of athletes in terms of recovery from concussion and the social environment, which suggests things like rehabilitation work. So I think it's more of a let's not forget that these injuries occur in a broader context and they occur to individuals who bring all their history with them at the time they're injured. And so I think it provides us with a more flexible way of approaching these injuries.
Thank you so much for explaining all that. And I guess sort of a follow-up to that, when it comes to pediatric concussion, in particular within the context of sports, what would you say are some of the um, most major biopsychosocial factors that tend to make the biggest difference between those who maybe recover normally and those who are having more persistent symptoms?
Yeah, I mean, I think injury severity does matter. There's this myth that like loss of consciousness and other types of signs and concussion don't matter. In fact, I think it does matter, and there's some interesting evidence that when you total up the number of overt signs of injury, that's actually a pretty good predictor of at least acutely and post-acutely symptom recovery. So it may not be one indicator in of itself, but this is why it's the importance of signs are reflected in the new ACRM criteria for concussion. You can have a concussion based on one sign. You don't need any symptoms, although usually the presence of a sign is going to have symptoms. So I think we do have to take into account injury severity in a variety of ways. And I think eventually in the next decade, blood biomarkers will probably come along that we'll be using more often. At a psychological level, there's a whole host of psychological factors that make a difference. But I think some of the ones that are most important are sort of psychological readiness to go back to play. And on its flip side, sort of fear avoidance and other things that drive or perpetuate symptoms, even in the absence of necessarily of any remaining physical injury. So we have all these factors that both put you at risk, but also psychological resilience that decreases the risk of persisting symptoms. And it's probably some balance. And I don't think we yet know exactly which ones are the most key. At a psychosocial, going into the social level, at least in kids, we do have substantial evidence that recovery is associated with parent adjustment as well as parental protectiveness and social support. And this whole idea of social support is becoming more and more intriguing to me because of some findings we've had in our research and others showing that kids' peer relationships play a really big role in how they recover. This may be part of the reason that sports actually, maybe kids recover a little bit more quickly from a sport because they have a social milieu that helps support their recovery, except for the kids who get really isolated from their teams. And actually, I think that can detract from their recovery. So I think we can see. I don't know that we yet know what are the most important at each of those levels, but clearly we know that there are roles of the injury, roles of the child's psychological functioning, and then their family environment and social and peer social environment to make a big difference.
Absolutely. I guess kind of wrap things up. What do you hope that researchers, clinicians, and general SNS members can take away for your upcoming talk at the conference?
Yeah, I think it goes back to what I said, that understanding concussion in a broader context. This really doesn't just apply to kids. I think it's just as applicable to adults, although the specifics obviously will vary as a function of developmental stage and what part and where the people are in life. But I think it's that sort of broader perspective of neuropsychologists are prone to think in a brain causes everything type of way. In fact, if we think back to our basic training in psychology, we know the environment shapes the brain. So it's a bidirectional process. And not surprisingly, then injury, although there tends to be this focus on what's happened to the brain and what's happened as a result to the person's function, brains never function in a vacuum. They always function in a context. And a lot of what we see are the brains or the person's attempt to adapt to whatever they're dealing with, and in this case, a concussion. So I think we need to just encourage people to think more broadly and always remember and think about the context and what that implies for management. That we actually have more tools available to us at a management level if we think more broadly in terms of that multi-level perspective.
Dr. Yeates, thank you so much for speaking to me today, and we look forward to learning more about your talk this upcoming May in Cleveland.
Super. Thanks,
Those,
David.
of course, those listening can learn more about the conference and register to attend on the SNS website, sportsneuropsychologysociety.com, and you can also follow SNS on Facebook and Twitter. Thanks again.